functions. Often, with these complex systemic diseases like COVID-19, the neurological complication takes some time to manifest. This is a nice picture that explains all the different neurological manifestations of COVID-19. SARS-CoV-2, possessing a high homology to SARS-CoV-1 and MERS, appears to have the capacity to injure the central and peripheral nervous system through direct and indirect ways. There are four main neuropsychiatric manifestations: anosmia and ageusia, cerebrovascular disease, peripheral nervous system, and encephalopathies. What's about anosmia or ageusia? Dysfunction of smell and taste have been widely reported in patients with COVID-19 in European communities. In Italy, the 40% reported having smell or taste impairment. However, only 5% in China, Wuhan, because of polymorphism of gene. Cerebrovascular disease, the formation of small or large blood clots, both in the brain and in multiple other organs, have been reported in a significant number of patients with COVID-19. The majority of patients had ischemic infarcts in both small and large arterial vessels. What about peripheral nervous system? SARS-CoV-2, similar to SARS-CoV-1, can cause serious injury to cranial nerves, peripheral nerves, and muscles. Also, Guillain-Barré syndrome can be brought on by COVID, and in general symptoms of polyneuritis, such as facial weakness, difficulty in breathing, difficulty in walk or being unable to stand, anosmia, ageusia, areflexia, ataxia, internuclear ophthalmoplegia, and encephalopathies. SARS-CoV-2 triggers an immune-mediated encephalopathy more than a direct viral encephalopathy. That's interesting. That's the way the virus enters in human cells. The binding of SARS-CoV-2 to angiotensin-converting enzyme 2 is a critical step in the pathophysiology of clinical manifestation in patients with COVID-19. This enzyme protein in the cell membranes of multiple organs also happens to serve as the receptor for SARS-CoV-2 infection. ACE2 can actually serve as a target for therapeutic agents against SARS-CoV-2. ACE2 has a wide distribution in multiple organs. That's the COVID invasion of the picture, including the nose, lungs, kidneys, liver, blood vessels, immune system, and the brain. After binding ACE2 in respiratory and then in epithelial cells in blood vessels, SARS-CoV-2 triggers the formation of a cytokine storm, that is a great inflammation. High levels of these cytokines increase vascular permeability, edema, and widespread inflammation, with consequent damage in multiple organs. The cytokine storm also triggers hypercoagulation cascades to cause small and large blood clots. In a recent American study, looks at what neuropsychiatric symptoms are most common in COVID-19 long haulers. It means someone who suffers from the symptom of a disease for an unusually long time. 70% were women, and the 85% reported experiences 4 or more neurologic symptoms, including brain fog, headache, numbness, tingling, disorder of taste and smell, and muscle pain. The 42% said that they had some issues with anxiety and depression before COVID disease. These are the most frequent post-COVID symptoms in an American study. There are a lot of psychiatric symptoms, like anxiety, problems, dizziness, difficulty sleeping. So, it is true that when we ask patients about respiratory symptoms, we should also inquire about low mood, anxiety, and psychological trauma. Psychiatry symptoms and disorders can occur in different categories. The first is healthcare workers. The prevalence of moderate to severe psychiatric symptoms was as follows in a Chinese study in April 2020. They suffered of anxiety, depression, insomnia, and traumatic distress. That means anxiety and fear of danger. After disasters, most people are resilient and do not succumb to psychopathology. Some people find new strengths. A primary concern after natural disaster is post-traumatic stress disorder arising from exposure to trauma, that is the pandemic. It concerns a rate of 5 to 10% of care workers. The second category is patients with COVID-19 disease. Patients with developed anxiety disorders, depressive disorders, post-traumatic stress disorder, substance use disorders. The third category is patients with pre-existing psychiatric illnesses. In an English study, people suffering severe mental illnesses like schizophrenia or bipolar disorder, for example, may be at an increased risk of contracting SARS-CoV-2 because there is social disadvantage and worse outcomes from COVID than the general people.